Okay, I've received my doctor's orders and I'm going to compare them to my MAR, checking my patient's name, checking the medication, which is gentamicin 60 milligrams, IV piggyback every 12 hours, and Lasix 30 milligrams, IV push every 6 hours. I'm going to check for the patient's allergies. The patient doesn't have any allergies, and I'm verifying the correct dose, time, and route of the medication. Then I would check the medications with the MAR, which is Lasix 30 milligrams, and I have my gentamicin 60 milligrams. I've already checked and made sure it was a safe dose, and the gentamicin is correctly diluted in 100 milliliters, and it is compatible with the D5 that I already have hanging, as well as the Lasix is compatible. And the rate of 17 drops per minute, and I'll give the Lasix over 1 to 2 minutes undiluted. It can be given undiluted. And for the gentamicin, I would check the BUN and creatinine and the urine output and the electrolytes. And when giving Lasix, I would check the patient's blood pressure before and frequently after giving the Lasix, and teach that the Lasix may cause dizziness, and teach the patient to call for assistance when ambulating. And then I would wash my hands, and I've already gathered my medications and my syringe. I would start by drawing up the Lasix. I'm giving 3 milliliters of Lasix. I draw up 3 milliliters of air. I'll recap my Lasix. 3 milliliters. Okay, then I would label my syringe with the patient's name, the type of drug, the amount, the prepared date and time, my initials, and the expiration date and time. Then I would check my my gentamicin for clarity and check the expiration date. It's clear and no segmentation. Then I would label my gentamicin with the drug additive, which is D5W, and the which is compatible with the gentamicin and the Lasix. And my initials, the date, the time, expiration date, the patient's name, the room number, start time, start date, flow rate. And I'm going to open my secondary tubing. Click it off. Then I would spike my bag and prime my tubing, being sure to get all of the air out of the tube. Okay. Now that I have my medications prepared, I would then take my medications and my MAR to my patient's room. When I get to the patient's room, I'll introduce myself. Knock, knock. My name is Jasmine, and I'll be your nurse today. I'm here to give you gentamicin, IV piggyback, which is antibiotic, and IV push of Lasix. If you could tell me your name and date of birth. Okay, and do you have any allergies? Okay, and I'll wash my hands and put on my gloves. Then I will assess the site for any infiltration. And I start by lowering the primary bag to see flashbacks to be sure that the IV is patent and flowing correctly. And I start by cleaning the port closest to the patient. For 60 seconds. And pinching in between the port and the primary bag. And I will give the Lasix over 1 to 2 minutes. Push and pause. Okay. Then I would start by lowering my primary bag. And hanging my piggyback. I would clean the port closest to the primary bag. And then attaching my piggyback. Unclamp my piggyback and regulate my drops using my primary clamp. Okay. Okay. Okay, now that I have my IV piggyback going at the correct rate, then it finishes and my IV piggyback is done, I would take my I would instruct my patient to ask for any assistance if they need help getting out of bed or going to the restroom, to use their call light. Then first I would close my piggyback clamp, replace my primary bag to the top, remove my piggyback. Return the primary bag to the correct rate that it was initially going at. Discard of all my equipment. Wash my hands. Leave my patient safe with the bed as low as possible and side rails up. Wash my hands. I'm done.